This is something that we work on all year, so it's really the planning of the courses and the development of the curriculum that takes a lot of time. When we arrive in Nicaragua, we provide a variety of courses. They're all set up ahead of time. And so we aim to provide courses that are relevant to the resources that are available. So there's no sense in us teaching things like, activate the cardiac catheterization laboratory if no catheterization laboratory is available. So we always discuss with our Nicaraguan counterparts in advance what parts are relevant to the resources available and what parts aren't. And I think that that's a really key point of our organization, that we're teaching in a resource appropriate manner. Another point that really countries in the developing countries can struggle with is that they don't have equipment available to practice on. So you can imagine if a hospital has one defibrillator available, they're going to be very reticent to let any learner, practice with it. And so what we also try to do is make sure that we come kind of in a self-sufficient way where we're set up with all of the hands-on equipment so that we can provide experiences where these physicians can practice on equipment, not have to worry about breaking their equipment, or the other situation is not have to worry about pulling a piece of equipment out of the patient care area in order to teach with it. So this past February when we went, we brought a team of 20 healthcare providers with us from the U.S. and then including actually so emergency physicians, EMTs, and nurse practitioners. So we have the whole range of the emergency care team from the U.S. and then we have counterparts in Nicaragua that help with running the courses as well. We hand carry most of our equipment. Since this has been going on for several years now, we now have kind of stores of equipment that are already in country, but each time we try to carry more equipment with us, and so we've been very lucky in that there's several companies here in the U.S. that have been very generous and donated equipment to our cause. It can be difficult if you've never been to that type of setting. It can be difficult to imagine, what it's going to be like, and in terms of teaching and kind of what the resources are. And so we try to educate new volunteers, very well before they come with us, and especially to make sure that they're aware of what the resources are available in the hospital, so that they're not spending a lot of time in their lectures or in their small groups talking about things that are not appropriate. I think just a real feeling that you're able to contribute something, contribute something to the field of emergency care and to the expansion of emergency care and to support of our specialty. Emergency medicine is a younger specialty when compared to things like cardiology or surgery, and so it's really still in development in many countries, and so we really feel, as a profession, we really feel it's important to support emergency medicine where it's developing in other countries and other parts of the world. I think it makes you very keenly aware of all the wealth that we have. Even working in a public hospital within a county system, we just have so many more resources than they have in other parts of the world, and it makes you very aware of waste and cost. And I think that's also something that kind of helps us to refine our practice when we come back to the U.S.